There you are.
Oh, okay. I'm glad you can see me because I can't see me, so that's fine. So I am Rose Eshe. I am the Northern Nevada Program Manager, and I come into this field with a little bit of both lived and professional experience. I worked with Child Protective Services for 14 years in California in varying positions and was raised by my Nana. So I have a little bit of both sides, although not quite as much as Audrey does.
All right, thank you. What we're actually going to be looking at is what services families actually need to maintain stability and what that looks like and what it means. We're going to look at the barriers that impact the rural and urban populations and how that looks differently. We're going to use our model of service and our navigator program to look at how services adapt and change for populations over time. And then we're going to look at our role as service providers to adapt to those needs of populations and do our best to serve effectively. Starting, I want to kind of get your guys' gauge on what do we think families actually need from us to maintain stability for their families. They need lots of support, absolutely. Emotional support, for sure. Our time, our guidance, for sure. Financial support is a big one. It lends itself into a lot of other things. Financial gets them housing, it gets them food, it gets them therapy services. Sometimes they're sometimes getting their home in compliance is something that they need support with. They need help navigating systems. Learning how to break generational trauma is a big one for us. Learning how to navigate resource systems, having someone that they can trust, what it looks like to have protective factors in place for their family. This list is non-exhaustive, but it kind of goes over all of those things, right? We have food, clothing, transportation, technology, things like court navigation or mediation services, therapy referrals, behavioral assessments, things that families need that they might not already have in place. And a lot of it comes from families having children placed into their care when they might have already been done taking care of children. We know that most kinship caregivers are grandparents. 4 of the 6% of children that are in care are being raised by their grandparents, right? And so knowing that our population might have had these things set up for the household before children came into care will help us to understand what they need now, because if they had the food, the money, or the housing resources to care for 4 people, they might not have that to care for 6 or 8 people now. When we're looking at all of these services and all of these resources, they fall into 2 different categories. The first one is going to be professional contact. This is the point of view of us coming into the situation and getting them the things that they need or the processes that are going to help them come into contact with helpful things. And the other side is the tangible resources. So that professional contact, it's the guidance from us on navigating those systems, on finding the resources. It's us being able to stabilize families sooner and for longer periods of time, because having a third party view or having extra eyes on a situation will get them what they need sooner. These are the things like respite care or TBRI training, trauma education, which is what Trista just mentioned to us, getting medical insurance for the kids, understanding their behaviors and how to get them assessed for different things. A language barrier is something that we encounter a lot of the time. So having translation services available, mediation in guardianships or during adoption negotiations is a really big deal. Understanding court processes, right? Families are not professionals. They are not in this world all the time. So they are not going to understand most of the time how to navigate the court system. It's not an easy thing to do. We are going to be able to get them the information that they need. And then having that emotional support from an outside perspective is going to be huge, telling them your feelings are valid. I know that your family is in dysfunction. You might be feeling some type of way about all of this stuff, but from an outside perspective, you are going through a lot and that's valid. And I see that. On the other side, we have tangible resources. And these are just the basic things, right? You don't need to be told what tangible resources are, but they're the basic needs that everyone should have consistently and predictably, just as basic human rights. But without these things, the rest of it can't thrive. We can't get to parenting classes and court navigation and the emotional support until we know that our food, our clothing, our home, and our basic needs are going to be taken care of consistently and predictably. And so these are the food, the housing, the clothing, transportation, technology, childcare, and money. Non-exhaustively, these are the things that we've identified as caregivers needing from somewhere. And tangible resources we can find clothing closets for, or we can find food banks or Urban League. We know of resources that are available for things that families need, but they can't always access that without our intervention or our assistance. And in the middle, we find that the culmination of this is just providing good quality care for the children that are in your home. We find that when caregivers are not able to provide good quality care to the children that have been placed with them, they're more likely to disrupt and say, I obviously am not capable of providing what these children deserve because I have to ask for assistance. I am not able to clothe them or house them sufficiently. And so maybe they're going to be better off somewhere else, which is where we get situations of guardianships being terminated, children being moved from a kinship home to a traditional foster home because resources weren't put in place. And so our job as service providers is to stabilize families so that children can have safe, stable, nurturing homes for as long as possible, because they deserve the chance to just be kids while they're still kids.
So we're going to move into what are some of the barriers for families to access the resources. So everyone has needs, not everyone has that access. And there are several reasons why families would not have access to the resources they need to build safe, stable, and nurturing homes for their children. Can any of you just chat out into the chat box what some of those barriers you think might be? Finances, yes, definitely. That's a huge one. Rural area, we're going to talk more about that. Waiting lists, oh, definitely. Transportation, absolutely. Housing, technology, yeah. Oh, you guys are just, oh my goodness, they're just flying in. You're right, there's so many barriers for our families to access these services. And so we have a list that we've come up with, which I can touch on more. Childcare, oh my gosh, yes, definitely. Language barriers. So again, a non-exhaustive list because you guys have already thrown out so much and we don't have childcare on there, and that's a very good point. So some of the barriers might be they don't exist. Maybe there's not enough people who need that service. Maybe it just doesn't exist in their area. As I said, we're going to touch more on the rural and urban areas. Language barrier. You know, do they not speak English? Maybe they are non-hearing. You know, they might have, maybe they cognitively have a hard time understanding what those services are and how to access them. Urban development. So like I said, we're with rural areas, we're going to be talking about that. But a lot of our professionals, a lot of our services have moved into urban areas because there's more money, more lucrative jobs, and there's just not enough to keep them in the rural area. There's poverty. Somebody had mentioned that. Actually, a few of you mentioned poverty. They fall within those income guidelines where they make just enough according to some arbitrary guideline, but that throws them out of being able to access that service because they do make too much. Although we find that making too much does not necessarily mean that they're able to care for their children financially and be stable. Knowledge, they might not know about services. That's where we come in, which Audrey's going to talk about more later, of providing that knowledge to them to say, hey, we've looked in your area. Here's what's out there. Let me show you how to get there. Technology, you've mentioned that. They might not have a computer, printer, or a scanner to access those applications that are needed. I know with one family I was working with, there is like a 10, 15-page application to access regional center services. And it's overwhelming. And she had no way to print out that 15-page application. Professional involvement. They may be, mistrustful of professionals. They haven't had good experiences with professionals, so they'd rather not. They would rather figure out how to do it on their own. So as I mentioned, rural communities often have more barriers. Rural communities, families are so widespread. I live in Lyon County here in Nevada, and it's a ginormous area that is so widespread. And it's hard for people who are maybe out in like not Ely, sorry, out in different areas to come into our county seat for Lyon to file our guardianship papers. So, so as I was just saying, they have to travel further to obtain those services because the services are not right there where they need to be. So our county seat is Urington. That's a good solid hour for me to get to where I live, and a good solid hour for maybe somebody insurers to get to. So they have to go much further. Social structures within towns. Families are, in small towns, everybody knows, it is a lot, but families, everybody knows everybody, which sometimes is a great thing. You know exactly what's going on next door to you, but sometimes that can be a really negative thing. We do have a family who everyone knows her, and they're trying to file for guardianship. Somehow their guardianship application got lost. So she has to go and now take the time to refile because they look at her like, well, you raised your son. He can't care for his child. So why should we give you guardianship? What did you do wrong? So that can be a real barrier. Deep mistrust of outsiders. It is a small community. And while the geographical land space is big, the actual communities are very small. If they don't know you, they're not going to come to you for anything. They're not going to reach out. They're going to go to their neighbor because their neighbor might know somebody. And so it becomes a barrier. Granted, they've created that barrier, but it comes out of having experiences that were not always positive. Hours of operation being limited. I have seen this so many times, especially in the small communities where a food closet or a clothing closet is only open on Tuesdays and Thursdays from 11 to 1. Who is going to access that? A lot of our families are working in maybe the mining field, or they're working in the farming field, which is not the 9 to 5 Monday through Friday. And they don't have anyone to care for the kids to go and get that, or maybe they can't take time off their job to go and access that service. So demographics being compounded, I just kind of touched on that a little bit. And we're going to go into our next slides that will show more of that. But yes, statistically, our families who are in the rurals are, maybe they're retired, again, working in those fields that do not give or do not lend them the time to go and actually access these services. So this is our rural family demographic. So they tend to be more Caucasian, more white. There is a lot of Native American families. African American and Latino American, not as great, but they still exist in those areas. And so being aware of that so that we know how to provide services to them can be very helpful. 90% of our primary caregivers in the rural areas are female, while 10% are male. Our caregiver age tend to be, as you can see, in that 50 to 69 range. So we're seeing a lot of grandparents who are raising their grandkids, and that affects how they access services. Marital status, majority of them do happen to be married. And for a lot of those, tends to be the husband is out working, the wife is in the home, or if it's the same sex marriage, one caregiver is working outside the home, one caregiver is staying inside the home. And so that caregiver in the home then has to figure out, how do I get care for these kids so I can go and access these services? There was a comment about social structures here in Nevada often impact barriers to services, so much so that small communities deny the existence of problems and therefore have low allocation of funds for solving problems. Yes, absolutely. We do have one. It's called a rural community. They don't think of themselves as that. And in their minds, and not in the people themselves, but like in the government minds, they deny that they have any needs. So they don't have a lot of resources there because they don't think that their people need it. What they're not hearing is that their people are saying, yes, we do need them. And we have to now go into another community to go and access those services. So continuing on with demographics of caregivers, the household incomes, as you can see, the rural is the light, I guess that would be peach colored. And so they tend to fall into that 50 to 74,000 zone, which again, when you're looking at the income guidelines, it tends to put them just over. And so they are not able to access the services that they need, especially when they are now taking on the care of their family or their fictive kin. So student, maybe a kid on their soccer team, so on and so forth. It puts them right out of that income bracket. On our rural families, we have a lower amount that have finished college and a higher amount that didn't finish high school. So we're looking at education. Do they know how to reach these services? Do they know how to interact with those professionals who may be looking at them like, well, you don't really know what you're talking about, so I'm just not going to take the time to explain things to you. Oh yes, we work with families for months and then they come back and say, what's kinship? Yes. Many of my older caregivers are more likely to not have, yes, that's correct. A lot of the older caregivers have not finished high school. So we'll go on to we're going to go back to Audrey.
So for our urban-based caregivers, I don't have graphs, I don't have statistics because the urban population is such a large mix of people of all incomes, all education levels, all ethnicities, all ages, right? There's such a bigger mix purely because there's a higher density of people that live in urban areas, which is part of the reason why rural communities have so much disparity in resource. There's just not enough people in those communities to sometimes warrant full services being put in place, which does impact a lot of families in their search of stable homes and lifestyles for their kiddos. But in our urban communities, we do have some specific barriers that impact them more. Things like household composition, the legal involvement with their family, and the cost of living. So for household composition, 6% of children in the US live without either parent in the home. However, this number does not take into account homes where parents are residents, but do not assume primary care of their children. So maybe multi-generational homes where the grandparents do assume all financial responsibility, all parenting jobs. They do everything to care for the children, even though mom and dad might live in the home. Or homes where maybe the oldest sibling is taking care of the children and mom and dad, their main residence is in the home, but they are in and out. They don't take care of the children. They don't assume any responsibilities. This being the case often creates a barrier for families to access services. Like here in Nevada, one requirement to access licensing is that the parents cannot live in the home. And so when mom and dad already live in the home, when an investigation is put into place, they might not ever get connected to licensing because it's not going to be an option for them. Another barrier is going to be legal involvement, which is a pretty common barrier that we see even with the families that we interact with that are informal, is that there has never been any CPS involvement. And so grandparents are taking guardianship of kiddos, or they've just never had any legal capacity. And because they don't have that paper to say, I've been placed with these children, or I have been given custody of them, they don't have access to financial resources. They can't go to the clothing closets that are high quality and high capacity because they don't have anything to show that they fit within this population. And then in urban communities, the cost of living is higher. Rent for a 2-bedroom household might cost the same as rent of a house for 4 bedrooms in a rural community. And that's just the reality of it. We might have a higher median income, but that's not going to stretch as far as it might in a rural community. So you have households that are living on that $50,000 to $74,000 a year, but they also have to look into food closets or clothing or rental assistance or things like that, because by the end of the month, that 50 to 74,000 is already exhausted. So they don't have any more funds to actually provide care for their children. And then in both populations, we have things like personal barriers. And it was mentioned in the chat a little bit earlier, healing from generational trauma is a barrier. It really is, because sometimes the only thing standing in the way of us doing our job is the caregiver that we're trying to provide service to. If we have a caregiver that is dealing with their own generational trauma, maybe their parents had a trauma that impacted them, that epigenetic trauma impacted their children, that impacted their grandchildren, and now we've come full circle and they're caring for their grandchildren. There's a certain amount of guilt that we often see grandparents experiencing because they feel responsible somehow for what has happened. Maybe there's something that they did when they were raising their children and created this issue for them, or maybe because of their generational trauma, their experiences with government entities, they don't feel comfortable accessing services that feel official, that feel governmental. And so we can't do our jobs because they aren't willing to participate. And then there's also generational resistance. And this can be for any age, but typically with an older generation caregiver, you'll hear things like, I don't want you to think I can't take care of them on my own. Even though I'm accessing this service, or I need money, or I need clothing, or I need food, or I need help, I don't want you to think I can't do this on my own. You're just going to think I want money for the kids. I don't want you to come in and take them from me just because I need assistance. Needing stable housing, needing assistance, needing help does not mean that we can't do it. It just means that we need a little bit of help, right? Everyone needs a handhold at some point. And so being able to acknowledge that and be okay with it is not something that comes easily to a lot of people. Yes, generational resistance is so common. I'd rather someone who really needs it take it. And that's something that I hear quite often. When I was doing our intake services here, that was a really common phrase. I would be giving them services and giving them options, giving them all of these things that they can access now that they're involved with us. But they're like, oh, well, you can just give that to someone else. No, I don't need diapers. I'll just go buy some. And I'm like, okay, well, are you going to be able to pay your rent at the end of the month if you continue to buy diapers and a car seat and clothing and beds for your kids? If those are things that I can help you get and you feel more stable and feel more comfortable while all of this change is happening, I would rather you let me do my job than feel like you're being a burden. I don't want to move forward until I allow for questions. Does anyone have any comments or things that we want to address before I start talking about our model here? Okay. So I'm going to go into our navigator model and actually through the lifeline of our services. We just hit our 10-year mark, so it'll take me a minute. But before I get into our timeline, there are 3 kind of main qualifiers that you have to fit before you can access our services. The first being you have to be caring for a relative or fictive kin child full-time. And so that comes into play when you do have multi-generational homes. If your if bio parents to the kiddos are living in the home and providing some care, we don't necessarily have the services for you. You don't necessarily fit within our scope. However, if you are providing that full-time care, regardless of what kind of legal establishment you have or resources that you need, or what services you're in need of, we can do what we can to assist. The second is you have to demonstrate a short-term need. And this is very important because we are not going to be able to pay your rent for 6 months. That's not our services. It's outside of our scope. But we can help you seek guardianship. We can help you walk through the licensing process. We can get you a pack of diapers every now and then, or we can connect you to outside services who can provide maybe the longer term needs that you have. We need to be able to help you with something short term. And number three, you need to have the capacity to provide a long-term stable home. Our entire goal, our mission statement, is to strengthen caregivers' capacity to provide safe, stable, and nurturing homes for children. That's our entire goal. We help caregivers so that children can thrive. And so being able to provide that long-term stable home for the child is very important. If you can't provide that, we're not able to necessarily help you with too much. We began, so our inception was in 2011, when our executive director, who you will meet later, recognized a lack of services for kiddos in kinship homes. And that was really what started it all. She recognized that there was a need and then took responsibility for filling it. A year later, we had opened our first office, and then the Kinship Navigator program began. When we began the program, there were 4 areas of need that we identified: emotional support, community connection, financial stability, and legal capacity. Those are the 4 needs that caregivers most often have when they come to us. And so through that, we developed support groups, family events, and case management. And that case management captures those last 2, legal capacity and financial stability. A year later, the number of families that program had served doubled, which shows the need for a service like this to actually walk alongside people as a third party and say, I know what I'm doing, I know what I'm talking about, so let me provide what I can for you. In 2014, we created the resource locator tool, and this is available on our website. Anyone can access it regardless of if you're caring for a child, regardless of if you fit those 3 criteria. Any person that finds our website can access the resource locator tool. And that's very important because part of our responsibility as service providers is giving information freely. It's very important that people have access to the information they need, regardless of if we actually interact with them or not. And so this resource locator tool was created to give accurate information that's specific for a family situation. You put in things like your age as the caregiver, your child's, your youngest kiddo's age, your zip code, and your legal capacity over them. And through that, it will give you information on what our services you have access to and what community resources we have identified as being helpful. Outside of the resource locator tool in 2014, we started providing our Department of Family Services info sessions for kinship families and created the Kinship Roadmap. And this began our journey of the Kinship Institute. This was like that first step of providing those info sessions. It allowed us to actually make contact with the kinship families that we are seeking to support through gaining that legal capacity. In 2015, we actually started the child welfare training program, and in conjunction with that, also started childcare programs. That is very, very, very significant because without childcare being available to caregivers, they're not going to be able to take the training that they need to become more effective parental figures to kiddos that have experienced trauma. Them being able to come in person and interact with a real life person who can answer their questions and tell them things that they have never heard before, and be able to bring the kids to and not have to worry about paying for a babysitter or leaving them with a family member or what have you, is going to allow more freedom of information. In 2016, we formalized the Navigator model and outcomes, which Leah showed you on our website earlier if you're interested. And then in 2017, we added the car seat safety and CPR trainings to the child welfare program. All of our trainings are free for all caregivers, including car seat safety and CPR. And those two are required in Nevada for licensing. And so we are doing our best to become a one-stop shop for the licensing process of kinship caregivers. In 2019, we expanded the Navigator program statewide, and that was in large part with the resource locator tool. Did a lot of research about how services are available in rural communities up north where Rose is now. And then we also passed the fictive kin TANF/kin gap bill here in Nevada, and that was a legislative thing that we did. And that's also very important, as I keep saying, because we are not only working at a base level with families, we're also doing what we can legislatively to make services more available to more people from a legal standpoint and from a government standpoint, because we can only do so much. There's only so much grant money available. We can't be everywhere at all times. We want to make sure that if we are not able to reach a family, they have access to things anyways. In 2020, we actually opened the Reno office, and then we began our respite program, which is a branch of our child care programs, allowing families to come and bring their children to our trauma-informed, TBRI trained childcare facility, have them be in good quality care while caregivers go to an appointment, go grocery shop, take a nap, whatever they need to do, and just have that respite available to them free of charge. In 2021, we received our evidence-based designation after a 3-year evaluation process from an outside person. And so now our Kinship Navigator program is actually evidence-based. It's proven that our outcomes for families are better than if they had never encountered our services at all. And then in 2022, so just this year, we've been able to open up a warehouse that we call Marcy's Heart that offers free, actual, tangible resources. So clothing, shoes, books, duffel bags, entertainment items, anything that the family could possibly need. We try to get in there, run through donations and stuff, so that we not only offer all the other stuff like the legal and the financial, like whatever, we actually offer like, hey, you can come pick up clothing. We have diapers, we have formula, we can come and meet you where you're at. We might not be able to get you TANF, but at least we can help you clothe the children, right? All of this to say, our model and our base of service is based off of 2 things, reactive services and proactive services. And to wake you up a little bit, because I know I've been talking for a bit, what would we describe reactive services as? You can also give me an example. What is an example of a reactive service? It's emergency, right? There's some sort of displacement that has to happen. Rent assistance after an eviction has happened. That's a reactive service. There is currently a problem, and how can we solve it? That's a great way to put it. Helping a family after the children have been placed in care, for sure. So that's what it is. It's offering services to a home that is already facing instability. And there's nothing to say that reactive services are incorrect, right? I have 2 words up here, reactive and proactive. Cognitively, proactive feels better, right? But we exist as a proactive service. Foster kinship is reactive because we have to have children in kinship homes before we can act. And we hope to never have to exist, right? We don't want to have children and families facing instability, but the reality is reactive services are just realistic. But what about proactive services? How are those different? This might happen. How can we prevent it? Great way, providing resources, supports, pre-displacement for sure. Exactly what it is. It's meeting a need before consequences are impacting the family. And to give you an example of how we are demonstrating both, it's our child welfare trainings coupled with childcare during classes. That's why it's so significant that we put those 2 things into place at the same time, so that families can get the reactive services of licensing trainings, but we proactively acknowledge you're going to need childcare while you're here. No one's going to be able to watch the kids consistently for you, most likely. So let's do that before you even ask. And those are the reactive versus proactive. Any questions so far? Any more comments? Help with resume building is a proactive service for sure. Okay, I'm gonna pass this back off to Rose for some of our responsibility stuff.
So what are our responsibilities as providers? So we need to look at when we are serving our families, what is it that we need to be aware of and that we need to hold responsibility for? So one of them, go ahead, Audrey, if you wouldn't mind clicking, is being respectful. So being respectful of cultural differences, generational differences, interpersonal and external triggers. So what does that look like? So cultural differences, maybe when you are going to a home visit and you ask, should I take my shoes off before I enter? It could be being aware that in some cultures, eye contact is very disrespectful. It could also be that just being aware, what are your own personal biases? What are your own personal prejudices? And putting that aside when you are working with a family. Yes, listening to hear, learn, and understand, absolutely. And that is a huge responsibility because sometimes that's all that they need. They just need to pick up that phone and know that you are on the other end of it and that you are actively listening. You're there in the moment with them. Or maybe, you're there in person and you are just present for them. Generational differences could be, yes, ma'am, yes, sir. For me, I was raised with my Nana. It was you don't speak to, you're spoken to. Maybe that's how they raise their children. So just being aware of those, it's not necessarily a wrong thing or a bad thing. It's just that they were raised differently and they're coming to the table with different ideas. So being aware of that and how we work with them. Yes, never judging, but they never calling elder people by their first names. So that's a funny one that I have learned between Northern and Southern Nevada. So in Southern Nevada, I hear a lot of my colleagues saying Miss June or Mr. Robert. And I up here in the North, they don't always, that's not always, looked at or not always wanted. If I say that, they kind of look at me like, what are you calling me Miss and Mr. for? That was my grandfather. What are you talking about? Yes, being open to having hard conversations, asking for answers you don't know and never assume, definitely. So moving on to the interpersonal and external triggers, as Trista was mentioning earlier, being aware of what our families, what might actually trigger them. It could be the way you look, the way that you talk. Trista said, having a loud voice is definitely definitely a trigger for people. So really being aware of what that looks like, not taking offense to it, but maybe being open. And, as someone had said, having those hard conversations. If you notice that they're pulling back, was there something that I said or did? Is there something that I need to do better? Being willing to hear those answers, asking preferences on how to address even with identities. Absolutely. So what are your pronouns? Being open to having that conversation with them. What do you prefer to be called? We actually have that on our intake form as a fill-in. What does that provider prefer to be called? Is it a shortening of their name? Is it a completely different name? Pronouns, absolutely. It is an involuntary relationship for sure. They do not have to engage with us. So we always need to be aware of that. Amish communities here and people have to understand the culture to have respectful communication with them. Yes, absolutely. And, we have a big Native American population here. So really knowing how to communicate with them. What does that look like? When I worked in a different position, I would have to, part of my job was going out to the Native American communities and teaching them about parenting. Imagine how awkward that was, to go into this whole other community that I'm not a part of and say, this is how we actually do things. Luckily, we don't do that here. We are we're very open and accepting, and we are very gentle when we talk about parenting. But I had to call ahead of time and say, hey, I have an appointment at this time. I will be there at this time. Couldn't have my government vehicle. Really had to be aware that I was going into their community and to be very respectful of what that looked like. Awareness of everyone's possible traumas, definitely. So moving on to the next one, reliable. We have to have families know we are going to show up. We're not just going to say, oh, I'm going to come into community and here's the services I offer, and then never show up again. So we have to be reliable in our communication. What we say is the same thing across different people. So they may call foster kinship and ask for me, but someone else is doing that intake. And the information that is shared with them has to be the same information that I'm going to be sharing. We have to make sure that we are reliable in that communication. Available. If I tell you I'm going to be there at 12 for our 12 o'clock home visit, then I need to make sure that I'm there. If I'm for whatever reason going to be 5-10 minutes late, then I need to make sure I call you and tell you I'm running a few minutes late. I'm so sorry. I'm on my way. Being available, knowing that people are going to need us. So we have to make sure our doors are open and that we are ready and we are getting back to them in a within that 24-hour period. And yes, we are closed on Sundays, but we're open on Saturdays. And one of our staff may get back to you on that Saturday if it's an emergency. So making sure that we are always there for them. Reliable in our knowledge, especially out here in the rurals, resources change. They move, they get shut down. And so when I'm sending a family out to a clothing closet, I need to make sure that I call that clothing closet ahead of time and go, hey, I'm sending this family this way. Is this still your address? Are you open at this time? Are these still your hours? So that we don't have families going out there and going, well, thanks for that, Rose. They're no longer there. And then I am no longer reliable in that knowledge. Adaptable. No one size fits all solutions. You all know, we all have different families. We come from different families. So what may work for one family may not work for another. And so we need to be adaptable to how we work with them and how we engage with them. Our locational needs. The Clark County office, the Las Vegas office, is in more of an urban setting. I'm out in the rurals. So for my rural families, I may need to drive out to them. They may not have transportation to get to me. So I might need to go to them and being aware of that. When I'm working in our Reno office, it's more of an urban setting. And so a lot of those folks can come into the office. So just being aware and being able to adapt to those different areas that I need to go to. With technology, a lot of our rural families and some of our older families may not know how to use technology. They may not be able to access it. So I need to be able to show them how to get to different things, or maybe I need to print it out and bring it to them, and or make them more aware of, oh, hey, there's this fast scanner app. I know you don't have a computer, but you can take a picture of that and shoot me that screenshot, and I've got you. We can absolutely move forward with TANF. We don't need to have any of those technological barriers get in the way. Adaptable in our communication. So realizing that not everybody's going to be able to hear things a certain way. Maybe they work better with a cell phone. So I need to text things to them because they're not going to pick up that phone and talk to me, which I'm kind of the same way, just as everyone knows. I completely understand that. In my professional setting, yes, I pick up that phone, but in my personal life, text me. I'm not going to answer the phone. So being aware of that and being able to adapt to that. Maybe they are not somebody who can hear things so well. So I need to show them. And maybe they need to have me walk alongside them. This is where we go. We go, here's the courthouse, here's where we file, and show them in that way. Self-awareness of where we are before engaging, and a mindfulness to be professional receptive at all times. Absolutely. Definitely knowing what our own challenges are too as well. We need to be trustworthy. So that goes, back to that respectful and reliable, being consistent. When we are consistent, then they know that they can trust us, especially in our smaller communities where I can come in and I may be handing out flyers saying, here's our services. And they're all looking at me like, we don't know you. And so if I keep going back to that community and keep going back and engaging and having that repeated presence, then I start to have that opening of the doors where they're like, okay, we've seen you a few times. You're still showing up. You're doing those community events. Now we'll start coming to you. That also helps in gaining what are the secret resources. So our small communities have what's known as secret resources. And there may be a handful of people who know what they are. They're not going to share them with you until you've shown that they can trust you. And then you will know, like, oh, I had no idea that that's where parents go for this secret Facebook or this secret clothing closet. So being trustworthy helps us to gain those resources. And being honest. If I can't help you with something, I'm going to say, I can't help you with that, but here's somebody who can. Let me point you in that direction. Or, if we have a family who is asking for guardianship and we know that there's a lot of maybe barriers that are going to come up for them, I want to have that honest conversation, that open and honest conversation with them and say, I'm noticing maybe you might need some more support in this area. How can I provide that for you? Or tell me more about this. Let's see how we can get you to where you want to be. So networking, I kind of already touched on that. Getting out to those communities and letting them know we're out there, talking with people, going to different community meetings and saying, here's what we provide. What do you provide? How can we meet in the middle? So if you provide help with applying for TANF and SNAP, so do we. So you're already offering that, but we offer this. Do you offer that? No. Okay. So maybe we can refer people back and forth to each other because you don't offer that, but we can. And so I know that you also offer a family resource closet on top of helping with applying for TANF and SNAP. So I'm going to refer my families to you. Being comfortable at saying, I don't know, let me find out. Absolutely. That definitely is part of that networking part too, of knowing who are our people out there that we can send these families to. So investing in those relationships, not just coming in, dipping in and saying, here's who we are, I'm going to leave now. It's really getting to know them, maybe going for coffee with them and saying, hey, what do you do? Because that way together we can help families and we can support families in a greater way. Encouraging, building self-sufficiency. So yes, we have, it's like that old adage of if you teach a man to fish, he'll eat forever. But if you give him the fish, he's only eating for that day. Something along those lines. I don't remember it exactly right now, but helping our families. So, because as Audrey was saying, we have a short-term need. That's how you get to us, is you have that short-term need. So we're not going to be there after that guardianship is granted. We're not going to be there after, you've already obtained licensing. So we need to help you help yourself. Yes, you can always come back to us for that emotional support. We are definitely all about that. Or yes, you can always come back if you have another short-term need that arises. But we want our families to be able to be self-sustaining on their own. We need to have compassion. Trista was saying earlier, we don't always know what walk that they've had, how they've gotten to us. So have that compassion for them and listen to their stories. Let them know that you are here for them. And you may not know exactly what they're going through, but I'm going to be here to listen. Celebrate successes. Yes, when a family has obtained guardianship, when kids have gone home, when they've reunified, because absolutely kids should reunify with their families when it's safe to do so. Celebrate those successes with them. You're not just here to come in, here's your resources and leave. We want to be there for you when you've done really well too, and to celebrate those successes with you. Listening, answer the phone. Absolutely. If you can't get to it right then and there, make sure that you're getting back to them in that timely manner. When you answer that phone, having that friendly voice, I'm here to help you, not having that judgment in your voice. Again, never assuming. We have no idea where a lot of these families have come from or what they've been through. So don't assume. be open. Being active in the community, again, yes, getting out there. I'm not just sitting in my office all day. I'm out there and I'm, walking the street and going, hey, library, who are your families? How do we reach them? Going to those family resource closets and saying, show me your process. If I send a family to you, what are they going through? Do they come in and they sign up somewhere? Do they come in and just go shopping? Like, what does that look like? So getting out there so I can tell my family, hey, when you get to this place, oh, and by the way, they're like kind of tucked in the back, so make sure you look. This is what's going to happen for you. Because that brings up a lot of anxieties for our families that they don't know, A, they don't know how to access some of these resources. And B, they're already feeling like, oh, I'm a lesser person or I'm a lesser parent because I've had to access them. It's, making sure that when you walk in the door, this is what you're gonna be greeted with. Here's who you're gonna talk to, can really be helpful. Stabilizer placement just because I was willing to listen. Yes, absolutely. Having that ear sometimes is all that they really need.
And how many of us today are looking to maybe expand our services or know a need that we're not feeling that we want to, that could be maybe aided by doing something as simple as just listening? Or maybe getting active in the community, having coffee with someone, building a connection, building relationship. Those really base level things that can sometimes get lost when we are in our professional brain are probably the most valuable parts of being a service for families and stabilizing good homes where children can thrive. So it is really, really, really important. I wish there was like an easy answer to say, this is how you get services to families. This is what you do. Like, do step 1, step 2, step 3. But that's not how the world works, right? We're not dealing with entities. We're not dealing with the government. We're dealing with people. We're dealing with grandparents and grandchildren and aunts and uncles and cousins and siblings who did not expect any of this to happen. They might have maybe seen it coming, but no one ever expects it to get this far. And so knowing that we can do our best to just kind of have these resume type qualities about us, being respectful and encouraging and listening to people and building a network, that's as much responsibility as we can hold sometimes.
Did you want me to continue on, Audrey, or you want this one?
Yeah, you can go ahead.
Okay. So knowing that we can only do so much, that yes, we're doing everything to stabilize the families, but that might not be enough. Some of our families have greater needs than maybe we can help them with. And we need to understand that and be okay with that. So sometimes we, going back to networking, maybe our services only work when we are working with another organization. And one of those examples is our the car seat program. Up here in Reno, I don't have the ability to have people come to our office and help them with their car seats because our parking is very limited, and we don't have the space for that. We don't have the bandwidth for that. But when I partner with REMSA, who is a local organization, and I tell our families, you can go here and get that car seat training, and you can go here and get that car seat, then that helps us to greater serve those needs. So we put in as much work as we can, and the family still pulls away. And that does happen sometimes. Sometimes they're just not ready, or sometimes it's just too much for them. And so again, meeting them where they're at and having that compassion for them is very helpful. When a situation is not unstable, but unsafe, it requires higher levels of service. Yes, sometimes we're just not at that need. Maybe the child has some serious mental health issues, and we are not able to help with our services because maybe that child might need inpatient treatment. An unstable example is a grandmother who might have guardianship and public benefits already, but is at risk of homelessness. Yes. So we need to partner with our housing agencies as the issue they're facing goes beyond kinship stabilization. Exactly. Our model only goes so far. We have to know when our limits are reached. We have to know what our bandwidth is and not go too far outside of that, because then we stop being helpful. We stop being useful. So at the end of the day, our responsibility to ourselves is to know that we did all we could, regardless of the outcome. Absolutely. So thank you. Does anybody, I think we have another minute for questions. Does anybody have any questions or comments? Thank you.
If you do end up wanting more information, or you want to chat more, or are just looking to get in touch with us, our emails are on the screen. The Southern Nevada phone number is how you can get in touch with me. The Northern Nevada is how you can get in touch with Rose. And then beyond just what I'm doing right now, we want to encourage everyone to maybe tag us on any social media posts that you make today. We've seen a couple of people tag us on like Facebook posts and stuff, and we love seeing it. This is a very virtual conference, so we're not actually able to like see you guys and make those like face-to-face connections. So we do want to see it. If you can tag us just at Foster Kinship wherever, that's just our tag everywhere. Do you have anything else to say?
Yeah, I just want to pop on.
Okay. So I'm gonna get going. Leah's gonna take my place for just a sec to explain what we're gonna do next.
All right, so it is lunchtime in just a few moments. So we are going to break from 11:45 to 12:45 Pacific time for lunch. So it will be 1 hour. We're gonna keep this on the entire time. So if you need to pop off, cool, we'll still be here. If you want to pop back on, if you want to just stay on, that works for us. When we come back from break or from dinner time, thank you, Laurel. Please stay if you can. Our director, Allie, is going to be presenting on, we're going to have a presentation from Sasha on permanency. And then right after that, we're going to chat. Our director will present to you on forging a path to reunification. And then we're going to end with resources for kinship, children in kinship care. We understand if you can't, though. We know the time zone, it's getting a little bit late. It's a holiday weekend. So all of this will be on our website, and I'm prepping the email that will go out to you guys right after this conference that will have the evaluation, and it will have the link to where you can find that. But we do still have 3 more awesome sessions. So with that, I will let you guys go to lunch or an early dinner if that is your flavor. And we will see you guys back in an hour. If you have any questions that maybe come to you during your break, please feel free to post it in the chat. And we're going to be here, so we will respond to you as we see them. So thanks so much. We'll see you guys in an hour.